Dr.Arzu ETEM. I am working as a clinical biochemistry specialist at Uskudar State Hospital in Istanbul. Here is a hematology analyzer. This analyzer performs accurate, complete blood counts called C-IDC test results on.
Hi, I'm Meryem Şimbil. I'm a general practitioner working in a home health care unit. Our patient population mainly consists of elderly patients who have difficulty leaving their homes. We visited an 82-year-old female patient who is completely bedbound and has a history of hypertension, hyperlipidemia, diabetes, cerebrovascular disease, and dementia. We observed that her urine has a purulent appearance and there was diffuse edema in her extremities. We took a blood sample from her for electrolyte, kidney function, and white blood cell control. However, I later learned from Mrs. ETEM that the EDTA tubes need to be mixed gently after the sample is taken to ensure proper mixing with EDTA. Since the first sample we collected did not mix sufficiently, it coagulated, and this was reported to us by the biochemistry laboratory. Thus, another team was directed to the patient next day to obtain a new sample, and it was found that the patient's parameters were within normal ranges. Thank you.
False low platelet result due to clot formation in the hematology tube. Laboratories save lives. CBC includes 22 parameters: white blood cell, red blood cell, platelet, etc. The hematology tube contains ethylene diamine tetraacetic acid, EDTA. You can see EDTA scattered on the walls of the tube. EDTA is a substance that prevents clotting in the tube. Although there is EDTA in the hematology tube, the most important reason for clot forming is that the tube is not mixed gently 8 to 10 times after the sample is taken. When EDTA is not mixed well enough with the blood, a clot forms in the tube. Platelet can only be measured with a hematology analyzer when clotting prevented. I would like to present a case I encountered in February 2025. By telling this case in here, I aim to emphasize the importance and contribution of the clinical laboratory in patient diagnosis and follow-up through a falsely low platelet value caused by a clot formed in the hematology tube. When I was evaluating the results, compared the platelet value with the patient's previous result, which we call delta check, I noticed a discrepancy between two results. The platelet value of 10 cubed per microliter is below the lower reference limit of 110 cubed per microliter. It indicates that the patient may be at risk of serious bleeding, may need to be hospitalized and treated immediately. Therefore, it is vital to accurately determine whether low platelet is real or not. Since the patient's hematology result dated October 2024 showed a platelet value of 532 10 cubed per microliter, the last result of 19 10 cubed per microliter dated February 2025, these two results are very different from each other. I decided to check the clot in the hematology tube myself. You can see the presence of a clot in the video image as I turn the tube upside down with my hand. Clot is very clearly visible now. Platelets play a role in clot formation. Therefore, while the clot in the tube is forming, platelets clumping in this clot, and the device cannot measure these clumped platelets. The device only measured platelets in the liquid part of the blood that does not have clot. Thus, I was sure that the low platelet was due to a clot in the tube of the patient. We informed the doctor through the hospital information system that the clot-related sample was rejected. We need a new unclotted sample for the analysis. Also, called the patient's doctor and informed her about the situation. The next day, a team from Home Health Services took a new sample from the patient and sent it to our laboratory. And the platelet result in the new unclotted sample was found to be 272 10-qubit per microliter, which indicates a normal value. Clinical laboratories save lives by providing accurate results, as in this case.